All right, I'm gonna wash my hands and I'm gonna gather up my equipment before I go see Wes, my patient. I have my doctor's orders and my paper for notes and recording vitals. I'm just gonna gather up my supplies right now. Doctor recommends a heat pack for him for some discomfort, and then I need to give a normal saline bolus. So I'll gather my normal saline, and then half strength, 5% dextrose for his energy levels, just replacing those fluids as I'm going through my medicine. I got the right patient, Wes, the right time, the orders for right now, and then right route. They're going to be both given through IVs, and then for the right reason, we want to do fluid retention, help with fluid retention. He's had diarrhea. Right amount, we have the dose here. I'm going to give 272 milliliters of the NS and 47.2 milliliters an hour for the D5. Right place, just making sure I have all that right route, right reason. Okay. I also have the orders for amoxicillin. It's going to be oral, so that is the right route, and it's going to be 6.8 milliliters. And I am going to give it through a syringe just to help him swallow it better, as well as acetaminophen. Oh, there it is. So I got the right medication, right person, right route, right time. It's now, right reasons. Alrighty. Then I need to gather up my stuff for vitals. I'm gonna need some alcohol prep pads as well. Some flushes for the IVs, and make sure I have my gloves ready. Maybe some diapers if we need it. We'll check with his mom and see how his bowel habits are doing. So I have all the stuff I need. I'm going to go head over to Wes's room now. Hi, Wes. I'm going to be your nurse today. I'm Spencer. Just going to go wash my hands real quick, and as I'm washing my hands, I'm going to gather up my stuff I'm going to need for my contact precautions before I go into his room. So he's got contact precautions with his gastroenteritis, and he's got RSV as well. So we just want to prevent any spreading. wash my hands before going in. And let me get some gloves on. First. Alright, and my mask on. Alright. Alrighty, sorry about that, Wes. I put my gloves on, and I'm looking at Wes right now, and he's not looking that great. He's looking bad. His skin looks kind of flushed, like he's dehydrated. He's grimacing. He's obviously in discomfort and pain, and he's moving around. So I can tell that he definitely needs some help. Wes's mom, Wes, what's your name? Oh, Cynthia. Cynthia, can you tell me his first and last name and birthday? Alrighty, and I'm gonna go just check his wristband. Sometimes I wander into the wrong rooms. I just want to make sure. Alrighty, good. That's Wes. And what's your name? Oh, Cynthia. Good to meet you. I'm Spencer, as I said. Cynthia, the doctors asked me to come in and help today. Wes, with his diarrhea, he's a little bit dehydrated, so the biggest priority is we want to replace those fluids. So I'm gonna start by giving him some fluids after I do a head-to-toe assessment, make sure we're on the same page with everything Wes needs. After that, the doctors also ordered another type of IV. This one has dextrose in it, with basically sugar. Just because he can't keep things down as well, we still want his energy levels to be up, so we're going to be giving him some dextrose IV, as well as acetaminophen, which is Tylenol. That's just to help bring down that fever and things to worry about with that. We want to just wash for any rashes that may appear on Wes, or headaches or anything, nauseous, as well as I'm going to be giving amoxicillin, which is an antibiotic, which will help with his infection. The side effect with amoxicillin is usually diarrhea, which may be kind of masked because with gastroenteritis, which is that stomach flu he's got, he may have some diarrhea with that anyways. But after it clears up, we want to be watching and see if he's having any more diarrhea and loose bowel movements. And so we're just going to keep an eye on him with that. Do you have any questions, Cynthia, with the medicine? Okay, why we're doing it? Not at this time. Okay, well, if you think of any questions, feel free to ask. We want to make sure that he's doing okay. Alrighty, I'm just going to start with my assessment. Hey, Wes, how are you doing? Oh, he's not very talkative with strangers. That's okay. Wes, I got a couple things I wanted to show you. I've got a fancy light. Do you want to take a look at it, Wes? Yeah, that's a fun light, huh? I'm going to be using that to look inside your mouth and your ears. Yeah, you can touch that. And have you seen this? This is so I can listen to your heart. Would you like to see that? No, still a little shy. That's okay. Does he talk? Oh, to you? Okay, well, maybe you can help out in a couple spots. Cynthia, thank you so much. Alrighty. So first I'm going to want to get vitals for Wes. Let me just gather my stuff. Wes, I'm going to put this on your finger, okay? Yes, okay. And as I'm doing that, I'm going to look at his IV site, see that there's no redness or pooling of any fluids. Make sure that that's still intact. And then I am going to take an axillary temperature because of his ear infection. I don't want to irritate anything in the ears, so we're just going to take that. Okay, perfect. And then I've got my blood pressure cuff. We'll take his blood pressure, and I've got his pulse. Let me write that down. So for his, should grab the pen out. For his temperature, I got 39 degrees Celsius, and that is a little bit elevated. We want it anywhere between 36.5 and 37.5. His heart rate was 151. That's elevated. His heart rate should be anywhere from 70 to 110. And then his blood pressure was 98 over 47. And we want that anywhere between 80 and 100 and 50 over 70 diastolic, yes. So it's a little low on the diastolic. I said he's got a fever with his gastroenteritis, and he's got a ear infection and otitis media on the right side. That would explain his fever, being uncomfortable. He's gonna have an elevated pulse. His oxygen is 92 though, which is good. The doctor's order says to notify him if it goes below 90, because he may need some blow-by air, but at this time he doesn't. And then, let's see. Alrighty. Okay, now I'm gonna start with my head to toe assessment. Since Wes isn't really talking to me, I'm gonna use the flax scale to determine his pain level. And looking at it right now, he's definitely got some occasional grimacing. So one for the face. He is a little anxious, not really relaxed, uneasy. So one there. He's shifting back and forth as well for his activity with the occasional moaning. So I'm going to give him a flax score of 4. So that'll be okay because we are giving him some Tylenol. So we'll watch to make sure, see if that pain level goes down. Alrighty. So Wes, can you ask Wes a few questions for me? Can you ask Wes where we are, Cynthia? Oh, the doctors. Yes, good. Okay, and ask him if he knows his name. Oh, Wes, good. He knows his name. Alrighty, perfect. And then he's been moving around and he follows orders okay, so we'll say he is definitely orientated times 4. And then I'm gonna just look at him on the coma scale, the Glasgow coma scale, for any problems with bed sores or anything. His eyes are spontaneously opening, so a 4, and he does obey commands when his mom asks him things, so 6, and then he is orientated to where he is, so 5, so 15, so he's really good on there. All right, now, okay, Wes, I'm gonna use this flashlight I showed you, okay? And I'm gonna look at your eyes, all right? So, just gonna be a little bright for a second, ready? Oh, good. Oh, good. That wasn't too bad, was it? Okay, his eyes are perla, his pupils are equal reactive to light, and they're accommodating as I move around. Can you follow that? Perfect. Okay. Now I am gonna check his mucous membranes, his oral cavities, and see his lips are a little cracked with the dehydration. His nose is a little pink from some running and probably rubbing on it, and it does look a little red from irritation. I'm gonna look in your ears, and I'm looking to see if there's any drainage, just because we want to make sure that that ear infection, especially on the right side, isn't progressing and we don't have any ruptured eardrums. Alrighty, thank you. So okay, and then as I go down, I'm gonna be looking at his skin. Yeah, his skin is a little flush. There's some tenting when I pinch it, so he is dehydrated. I'm gonna check his pulses on both his radial. Okay, yeah, his radial pulses they're weak and they're easily obliterated, so I'd say they're just a +1. And I'll check his brachial pulses as well. Yeah, about the same. Wes, can I look at your toes for a second? Alrighty. And then I'm just gonna check his pulse in his legs. Same as well. He's just got a weak pulse. He's got that low blood pressure, so I'd say +1 for all of them. Thanks, Wes. Okay, Wes, and his IV site did look good. Wes, I'm gonna listen to your heart. Is that okay? I'm gonna use this, all right? Alrighty, now I'm gonna listen to your heart, Wes. Okay. Alrighty, he does have that rapid heartbeat. I'm gonna take his rate for a full minute. Yes, it's still elevated, about 150 still again. I got 146 when I took it for the full minute. Wes, I'm gonna listen to your lungs, okay? Can you breathe in deep when I put my stethoscope on you? Just like this? Yep, good, deep breath. Thank you so much. Another deep breath. Perfect. And one more here. Oh, how about over here? Can you give me another deep breath? Thanks, Wes. All right, just a little bit more deep breath. And deep breath. Wes, I'm gonna listen to it on the back side too. Can we sit up a little bit? Oh, thank you, Wes. All right, let me just listen. Deep breath. Deep breath. And then just a couple more, Wes. You're doing good. Deep breath. Good job. Deep breath. And now the bottom. Oops, sorry, I'm getting it wrapped up on you. Alrighty. And the last one. Okay. So thank you, Wes. So his lung sounds are clear, and he's equal on his breathing on the right and left side, bilateral breathing. So the lungs are sounding good, and the heart, distinct S1 and S2. So his heart's sounding good too. Alrighty, Wes, now, your belly been bothering you? Yeah. Wes, I'm gonna go listen to your belly for a little bit, okay? And as I do that, Cynthia, has he been having frequent bowel movements still? Oh, he's on his 4th wet diaper just this afternoon. Okay, yeah, that's frequent. Has he been having any skin breakdown, rashes? Let me check. No, you haven't seen any? Oh, good. Well, I don't see any either. That's good. We'll just want to make sure that we just continue to change him quickly when he has a bowel movement. That'll just help his skin not break down. He's got enough problems as it is. We want to keep him feeling as good as we can. Okay, Wes, like I said, I'm going to listen to your tummy, okay? Alrighty. Okay. Okay, oh yeah, he's got some hyperactive bowel sounds. We've got some rumbling in our tummy. Yeah, I know, buddy. That's from all that diarrhea working through. I'm sorry. Now, Wes, I'm gonna push against your tummy, okay? And you tell me if it hurts at all, okay? I'm gonna try to be soft. I don't wanna hurt you. Just let me know how that feels. Okay. Alrighty, that's a little tender, honey. I'm sorry, I saw you grimace there. Okay, his stomach is firm, but it is a little tender to palpation. Alrighty. Okay, well, Wes, we're gonna try to get you feeling better, okay, buddy? I've got some medicine the doctor has asked me to give you that'll help you feel a lot better, okay? Alrighty. Oh, you said you saved the last diaper? Oh, okay, over there. Yes, thank you. Yes, the doctor has asked that we save those just because with all the fluids he's losing, he actually loses fluids in those diuretic bowel movements. They're really runny and watery. So we want to replace that fluid, okay? So I'll go over there and check its weight in a second. All right. The first thing we're gonna do, Wes, I got some fluids for you to help you feel a little bit better, okay? Yes, so. Alrighty, Wes, yeah. Let me hook this up to the pump and I'm gonna program it. I'm gonna check the doctor's orders. Yes, 272 milliliters as fast as possible. So I'm actually just gonna open it up all the way for the bolus of this. Okay. Now, Wes, I'm gonna clean it off, okay? Yep, just like washing our hands. We're gonna wash this up, okay? Thanks, Wes. Okay, good. Now, Wes, I'm gonna put some water through it, okay? Just make sure it's working just like it's supposed to, okay? Alrighty, let it dry for a bit. And hook it in. And I'm gonna flush about 5 milliliters through it. Alright, yeah, okay. Alrighty, and we're gonna keep track of all that fluid because the doctor has ordered it. And this is clean still, sterile. Okay, let me hook this up real quick. Oh, it's not wanting to click in, huh? It's okay, we'll give it another try. Okay, and then I've opened this up all the way for the bolus. Alrighty, that's running through good. Okay, Wes, you're doing great. Now I just got a little bit more, okay? This one is to help you have a little bit more energy, okay, Wes? So I'm gonna check I've got the D5 half NS string. I've got that gathered up. This flush is still sterile, I haven't put it down. So I'm gonna use this to flush the tube. We can only get this to work. Oh, perfect. Okay. Alrighty, make sure that this line is clear and not tangled up. Okay. And I'm going to program the pump for, so side A, D5 half NS, oh sorry there, Wes, and 47.2 milliliters an hour. Okay, good, I'll be ready to start that. Okay, I'm just gonna clean up the second line. You're doing so good, Wes. I know it can be a little scary, buddy, but the doctors and your mom, they're gonna take great care of you. And you'll get better soon, okay, buddy? I'm gonna flush this line as well. And we're gonna do another 5. Okay. That line is flushed. So we'll get it started. It's on the pump. Okay, let me go ahead and start the pump. Line's clear and starting to run. Okay, good. It's opened up. All right, perfect. Okay, now we got some medicine to help your tummy feel better and so you don't hurt so much. Okay, buddy? Okay. The doctors also ordered him some amoxicillin. Ooh. I'm gonna have to go run and grab a cup for this, sorry. Run up there and grab all the cup and clean everything up. Okay, I'm back. Should have grabbed that cup sooner, sorry. Cynthia. Okay. Now for the amoxicillin, he's got 6.8. And you said he uses a syringe just fine over the cup. Alrighty. Let me pour this out. And I'm going to pour a little bit above it. That's okay, because I want to make sure I can get this 6.8. 6. And then almost to the 7. Okay. 6.8. All right. So, right patient, right route, right reason. Got one right. Okay, Wes. And the right time. Note the time. Yep. Okay, Wes. I'm going to put this in the corner of your mouth. Okay, buddy? All righty. Good job. Yeah, go ahead and swallow that. Yes, that will help you feel a lot better, buddy. Okay, now I'm going to go and do the Tylenol. And the order for that is 4.3 milliliters. Both of these are calculated off of his weight. And I've double checked that that math is correct. So I'm going to do the acetaminophen. Okay. And I'm going to just use a 5 milliliter syringe because and he needs 4.3. It's right in between that because it's 0.2. Okay, yep, this is just some Tylenol, Cynthia. It'll help with his fever and also help him so he can not feel so bad, maybe get some sleep. Alrighty, Wes, are you ready? I got some medicine for you, okay? Open up, thank you. Alright, down it goes. Perfect. Okay, now, since I had that running, I'm gonna go and check the stool real quick. I'll weigh his diaper. 120 milliliters for the stool because we've factored in the diaper weight. So the orders are, let me change my gloves and I'll do a hand thing and put this on. We don't want to contaminate anything. He says 1-to-1. So we already have NS hooked up as a bolus, but I'll hook it up to the pump and then I'll program it for 120 milliliters to replace it. Alrighty, let me hook this back into the pump. We'll do side B and normal saline and 120 milliliters and we'll infuse it over the hour. Alrighty, so now that we've got the maintenance fluid going and we've got his dextrose going and we've given him all of his medicines, I'm going to reassess him. It's been about 30 minutes after all this is done, so I'm going to retake his vital signs. Wes, I'm going to take your vital signs again. Alright. And then as I retake them, blood pressure and his pulse ox. I'm going to look at the IV things. There's no occlusion, there's no redness, no pooling. Good, that's looking good. Alrighty. Well, Cynthia, that's everything. His vitals are looking much better. His temperature's down to 38 degrees Celsius. So still a little bit of a fever, but it's coming down. So we're happy about that. His pulse is doing much better at 120. So still a little bit above where we want it, but everything is looking better. His blood pressure was now 96/60, so that's much better. And his oxygen is actually 94. I think with the relaxing, he's just breathing a little bit better. So, Cynthia, before I leave, do you have any questions? Okay, well, with the medicine, like I said, with the Tylenol, you're going to want to watch, make sure no rashes develop or anything. And with the amoxicillin, you may still have some diarrhea. So just watch for that. But after his gastroenteritis clears up, we're going to be wanting to monitor for that. With gastroenteritis, it's basically a stomach infection. It usually happens, you can get it from one of the kids at the playground, or eating something bad is usually how they get it. He did test positive for RSV, so we're going to want to keep him away, keep precautions with who we're playing with and staying with. It's just a respiratory infection, so just monitor for that and for his earache. Make sure that there's no drainage coming out of that ear. The amoxicillin will help with that. So just want to make sure it's not getting worse and that it's cleared up. Should hopefully clear up in a few days, but make sure that whatever the doctor orders for how many days you should take it, 7 or 10 days usually is what it is. Make sure he takes the whole doses for all the days. It's usually twice a day that he'll take it. But you want to make sure that even though he's going to feel better after all his treatment, we want to make sure that we give his body the full amount of time to recover as well. Cynthia, do you have any questions or anything? Wes, you've been a great sport. Thanks for letting me hang out with you, buddy. And if you guys need anything, you can always press your call light. He's looking comfortable, much better. And his skin trigger is doing better as well as tempting. So I'm happy that everything's going along. We want him to get better. So you guys have a good day.